Hi, my name is Sydney Rudolph, and today we are going to be discussing synthetic cannabinoids, also known as synthetic marijuana. Now, you may be wondering, why do they call it synthetic marijuana? The reason being is because it binds to the same receptors within the brain as THC to produce cannabis-like symptoms. The most common forms of synthetic cannabinoids that are produced today are GWH 018 and AM 2201. The most common route of administration is inhalation, but it can also be ingested. But from here on, for the video, I will be discussing it in terms of inhalation. Although amounts of absorption are unclear, what is clear is that it appears to occur in the lungs, to the bloodstream, to the liver. That's where majority of metabolism occurs, although some of it also happens in the kidneys. This also means, because it's going via inhalation, it bypasses the blood-brain barrier and also first-pass metabolism. Some of the non-specific things that synthetic cannabinoids and marijuana bind to are cellular membranes, which act on opioid and benzodiazepine receptors, prostaglandin synthetic pathways, and protein metabolism. Now, how is it metabolized? Synthetic cannabinoids are metabolized via oxidation by cytochrome P450, then conjugation by UDP glucuronidyltransferase UGT before urinary excretion. It is excreted as glucuronic acid conjugate. Individual differences and amount of drug can also affect how fast it is metabolized. So what receptors does it bind to? It binds to the CB1 and CB2 cannabinoid receptors in the brain, which is pretty much what the CB stands for. But it stimulates the CB1 receptor more than CB2. This is true for THC as well as synthetic cannabinoids. Now, where are these receptors located? They're mainly located in the CNS, with the CB1 being mainly in the brain and the CB2 mainly being on peripheral tissues, lungs, liver, and kidneys. Now, is it an agonist or an antagonist? Synthetic cannabinoids are actually full agonists, while THC is only a partial agonist, meaning that synthetic cannabinoids not only have a stronger effect, but they also have a higher affinity for binding to these receptors. This also means greater risk for toxicity. Some of the behavioral factors include tachycardia, vomiting, drowsiness, lethargy, nausea, hypertension, dizziness, vertigo, and chest pain. One of the mood effects, or the only mood effect, is agitation and irritability. And a few of the cognitive effects are hallucinations or delusions and confusion. One of the things that's interesting to note also is that synthetic cannabinoids have been linked to, in at least two studies that I've found, psychotic relapses in patients that were already in inpatient care. And also, there are some studies that suggest that synthetic cannabinoids cause acute psychosis in genetically predisposed individuals. So if you don't know your family history that well, it might actually be dangerous for you to be taking some drugs. Some of the tolerance factors include that chronically over time, THC has been found to downregulate CB1 receptors, and it's hypothesized that synthetic cannabinoids do the same, but unfortunately there isn't enough information on it for us to know today. Some of the physical dependency factors include drug craving, elevated blood pressure, nausea, tremor, diaphoresis, nightmares, and then lastly, the withdrawal factors, which are profuse sweating, tremors, agitation, insomnia, headache, nausea, vomiting, and diarrhea. They say that it takes at least 4 weeks for these CB1 receptors to go back to their normal, so I guess to be upregulated again. But again, it's all hypothesized because we don't actually have the research on it yet. But hopefully soon, because it's actually a very potentially dangerous drug, synthetic cannabinoids, that is. Thank you for watching.